I am Dr. Eli Camp. Welcome. This is my podcast, Vital Wisdom. And this is where I talk about health, wellness, homesteading, raising children, and lots of other topics, all from the perspective of vitalism. I believe I've seen and taught others how the body can heal itself if it's given what it needs, it's not poisoned, and the innate healing ability of the body has been supported, not suppressed. It is my intention to bring what I have learned in my life, especially the last 24 years of being a physician, to help you be your own best doctor. Hope you enjoy the episodes, and thanks for being here. Hi, everybody. This is Dr. Eli Camp with Vital Wisdom. So glad you could be here today. And I have a special guest, Dr. Kayla Cook, who's going to talk to us about thyroid and whatever else comes up. Thanks for being here. Why don't you tell everybody a little bit about yourself and where your practice is and all that?
Yeah, well, first of all, just thanks for having me. Super excited to chat with you today. Our practice is in Arvada, Colorado, which no one knows where that is, but in relation to Denver, it's kind of just west of Denver, kind of between Denver Boulder area, so kind of like West Denver. We've been here for the past like 8 years. Really, really love it. My practice focuses on thyroid health. I see a lot of Graves' disease here. So that's really my specialty, I guess you would say.
Mm-hmm.
But yeah, I mean, that's pretty much it for our practice.
That's cool. And you graduated from which of the naturopathic schools?
NUNM now, I think NCNM when I went, but
Right.
the one in Portland, Oregon.
Right. And who are you in practice with?
My husband, Dr. Linsegrave. Nobody can say his last name, so we just say Dr. L.
Dr. L. That's cool.
Yeah.
And do
Yeah.
you do mostly adults or do you also see kiddos?
We really just see adults. I don't see anybody under the age of 8 as just part of like Colorado has a very specific legislature around age ranges. So I don't see anybody super, super young. I'm actually, my pediatric practice like fills super quickly because I think there's just so many kiddos that need help. And so we're not really taking new pediatric patients. So focusing mostly on adults at this point.
Okay, well, that's good to know. Every time I do an episode, of course, my guests often get quite a few calls. And as you know, there's a lot of people looking for help with their kids, especially kids who've been vaccinated for vaccine damage. And it's there's not enough of us out there, I don't think.
The good news is in Colorado, there are a handful of really good pediatric naturopathic doctors. So happy to give a referral for that if anybody needs it. Or
oh, good. Okay, well, that's good
so
to know.
it's not a hopeless state to be in if you need help with kids. There's just some really, and honestly, part of why we were able to like not stress too much about not being able to take new kiddos is because there are some really good people that move to the area that can help. So
yeah, Colorado got licensed a few years ago, right?
yeah, it's been really confusing because they've been licensed for a while, but for a period of time it was called like just registration, and it was like the same thing, but the nomenclature was weird, and so I think it's confused the public of like what is the status of the legislation here, but yeah, we're licensed and it's really good scope of practice. I'm really happy being here.
Oh, good. Well, there's a gal, so when the whole COVID thing hit, there was a mass influx of people into Oklahoma who were looking for more health freedom in the choices that they could make. And we have a family here who's part of my homestead ladies group, and she has a child disabled who she was telling us all the other day that Colorado gave her no issues whatsoever in paying for her supplies for her child, but she's come to Oklahoma and she's having a hard time. So it sounds like, as always, Colorado's the place to be.
Yeah, it's pretty hard to leave. Not that I'm really tempted, but it's honestly I feel pretty safe practicing here, and I think people are able to get what they need, whatever that is. And yeah, I was really grateful to be here for the last, 8 years, and especially when everything went pretty crazy. So
Are you
we were
more in
able
the
to still work.
mountains?
We not really. We're like the foothills is what they call it. We're kind of in that sweet spot of like right before it gets like when you get into Boulder, you're starting to get a little bit more mountainous, but we're we're really kind of in the just the fun little foothills part of it. Yeah. I
Well,
would
cool. Well, so thyroid is such a great topic, I think, to
yeah.
talk about. It's, in one way, one hand, I've watched thyroid issues just explode over the last 15 years. Like, I remember when I graduated in 2005, there was thyroid stuff going on and people struggling, but it seems like it's just escalating and
Yeah,
going
it's
through the
really
roof.
really wild, I would agree. Especially Graves' disease and like seeing that younger and younger in people is has been pretty mind-boggling because I mean, even in the past like 3 years, I think it's shifted a ton. Um, so yeah, it's an important topic. I myself struggled with thyroid issues and wanted different options. And so I feel like I have kind of that personal experience of how much it can suck, but also seeing just thousands of women go through it and even people that come in with just a laundry list of symptoms who don't necessarily have a diagnosis, like when we do, thorough workup to see what's going on, 9 times out of 10, they do have thyroid issues. And so it's just one of those things that I don't think is like as thoroughly like looked at anymore because everyone just is like, oh, it's normal to be tired. Everyone's tired. And
Mm-hmm.
people get sort of just gaslit medically. So yeah, it's just been wild to see
Mm-hmm.
how
Yeah,
many women struggle with it.
gaslighting is definitely an issue, especially in
Yeah.
mainstream
Yeah.
medicine, because they don't really know what they're looking at. So, for
Yeah.
those folks who watch my podcast and listen to my podcast, give us like a basic rundown. Like, what is the thyroid? Why is it so important? What kinds of symptoms do we see when the thyroid, goes hypo or hyper? Because you said Graves'
Yeah.
disease, but let's
Yeah.
let's educate people just a little bit.
Well, I mean, basically the thyroid controls everything that you like ever makes you feel good. Like energy, mood, digestion. I mean, it's like when you look at the list of things that the thyroid actually does physiologically, it kind of touches every system. It's like there's nothing I can really think of. I mean, because even like joint pain, right? It can contribute to joint pain. It can contribute just about anything. The things
Mhm.
that I see the most really like plaguing people that they maybe don't correlate with thyroid initially is really like brain fog, cognitive, like nervous system stuff. Anxiety and depression just seem to be like rampant on the rise. And that can absolutely be from the thyroid. Some of
Mhm.
the things where like hypo or hyper are gonna differentiate. I mean, you can have a lot of overlap in the fatigue and some of the cognitive stuff with either of them. But where you see the differences, like hyperthyroid, you're gonna be like losing muscle mass, losing tons of weight at like an alarming kind of rate where
Mhm.
uh, people are actually pretty scared. They have absolutely no exercise tolerance. So like walking to the mailbox might make them extremely winded and their heart rate is really, really high and pumping and just like they can hear it in their ears when they're sleeping and it's just very scary. Whereas hypo is the other end of the spectrum where it's going to be like really everything is super sluggish. Um, but one of the things about that I would like to educate people on that I see like one of the biggest, most frustrating pieces of this is when it comes to the testing for thyroid, all you ever see being done is, TSH, right? That's like the most common, that's the thyroid stimulating hormone. But that's actually a pituitary hormone. That isn't actually even a thyroid hormone. So it can be within that normal range, right? Which is like that's a whole other conversation of what's like normal versus actually ideal and optimal. But they're not getting really a full workup to see how is that entire kind of hypothalamus pituitary thyroid axis working with all of the hormones. And so that gets missed a lot because people are like, well, your TSH is fine. See you later. That's all insurance wants to cover.
Mhm.
And that really frustrates me because you see just a ton of, incorrectly diagnosed or misdiagnosed aspects of that. You should be having actually, free T3 checked in these things that are kind of the full thyroid panel. And that I would say education wise for people listening to this is perhaps one of the biggest things for advocating, I think, for your own healthcare. I ended up even creating like a cheat sheet of like, bring this to your doctor and tell them to order these things because without all of this, you can't really say for sure what's going on. And we need all of this information, not just this one piece that can fluctuate day to day and time of day and things like that. So when it comes to being educated about what labs are appropriate for the thyroid to actually assess it, I think that's huge, and people just really have no clue.
So it's TSH. We still want to check that.
Mm-hmm.
Free T3.
Yep, you want to do, I do free and total T3 and T4. So that's going to look at what is actually like available to use and what is, bound up and not quite like ready to use.
Mhm.
So you get sort of the full spectrum. I also like to look at antibodies. It's amazing how many people will come in hyper or hypo. And I'm like, oh, what are have you had antibodies checked? Do you know if this is autoimmune? And they look at me like I have three heads. They're like, what are you talking about? And
Mhm.
and then, it's unfortunately really common to have that autoimmune component. And so making sure you're actually testing the right antibodies. And I've seen with like Graves specifically, women that do have Graves, but it's missed for so long because they test them for the Hashimoto's antibodies, and what they really need is a different antibody test. And so it made it really easy, because honestly, when someone's just like spouting out, here's this list of things in like a spoken form, I think people get really lost and confused, and they're like, what letter was that? What number was that? I don't know what you're talking about. So that's why, and I can like attach that guide. I don't know if that's something that you want to be able to send your people, but it's free. It's not something that I like need, compensation for.
Mhm.
Anyone can have, but I want anyone to have access to that.
Mhm.
To kind of give them just that, like a written form of like, here's what you need. Don't stress about it. Like, we got you.
Well, maybe we could definitely attach that. One of the things I commonly do when I have handouts is I just make a little Google form and they send me their name, their email address, things like that. And
Yeah.
then they get an automatic email back with the download link. So you won't
Yeah.
get inundated with with emails, right?
Yeah.
And if you don't know how to do that, I can walk you.
I kind of have what you're talking about set up. So one of the links I sent you with just like my um, link in bio, it has that attached to one of the links on there. So if people are interested, they could go to that link and find
Oh,
it.
good.
It's
Oh,
just
good.
called Thyroid Labs Cheat Sheet, but it's like a checklist. So it's like, make sure you had, because there's other things too, like looking at, iron, looking at, vitamin D, looking at like there's other nutrients and things we want to look at to just assess the overall situation. So it has all of that on there. And there's like here's kind of like your basic essentials, and here's like if you really want to be super thorough, here's like an extended version of that. So I think it's nice to give people something that they can actually bring to the office when they're seeing whoever their doctor is, and actually say, okay, can we get these rest of these things done?
Hmm. Well, that's very generous of you, and what a great resource. So on my podcast, we talk a lot about vitalism, of course, and a vitalistic approach to helping people restore their health. And so I know that there's folks out there who are asking two questions, two big questions. The first question is, well, what went wrong? And the second question is, because of course mainstream is pervasive, and a mainstream approach to managing, I want to say our health, but really right, I don't know so much that they're managing our health as they are managing sickness, right?
Yeah.
um like how does that look different when we start talking about from a vitalistic? So maybe question one, what happens, what goes wrong that
Yeah.
do we even end up with thyroid issues?
That's such a loaded question, because there's a million, and I kind of like love and hate this question,
I know, me too.
because I love it because it gives it a chance to be like, let's shed light on like what could be going on, right? And that's such an interesting, important conversation. And at the same time, where I hate it, I think that it can be asked in a way that ends up like kind of bringing shame to people of like, what did I do wrong?
Yeah.
And I actually see the like like the mental, like mindset, nervous system component being like the number one driver of why people are struggling and like can't get out of the trap, even when they know the right things to do, like the great vitalistic tools that you're teaching, right? Like, I know what to eat, but I can only do it for a week, and then something, I can't keep it up, right? Why is that happening? Right? So there's all of these aspects of this question that I think it's like we could probably talk about it for 8 hours and barely scratch the surface. But there's a million things that could go wrong, and I don't think that it's like one singular thing that like oh, if you just hadn't eaten that candy bar, your thyroid would be fine, right? I don't like it looking at it from like a kind of a shame and blame lens. And I think a
No,
lot of people ask that question of themselves kind of from that perspective. Do you know what I'm talking
I
about?
do. I do.
Yeah. And so I like to sort of like with that out there and saying this isn't a conversation to be taken of like, oh, if I could have only been more perfect, I wouldn't have thyroid issues. I want to kind of like speak to that and say, let's take that lens away from looking at it, right?
Absolutely.
Um, but the reality is like we live in a really different, and people say we live in a really toxic world. I kind of like I get frustrated a little bit by that language too, because I think it comes down to how our body is like resilient and managing what we're faced with, not so much like we're a victim to our environment. Um, but at the end of the day, we are faced with more things that the body is like taxed by in our air, in our water, in our food, and I think our stress and emotional state is so much worse, over the last few years. And so there's all these factors that all together, cumulatively, without the tools to help the body manage any of those things, that's what leads to illness, right? The bucket overflows and we start to have symptoms and illness, right? And so it's not like this one thing that goes wrong or this one thing that like, oh, if you could just live in a perfect sterilized bubble boy life, you would never be sick, right?
Mhm.
And arguably you might still be really sick if you're left with your thoughts that are really unhealthy. So
Right.
there, right? But that's how I look at it. And I'm always thinking, like, especially with thyroid, like what happened, between the ages of like 1 to 7 years old, because that's really when our GI tract and our thyroid's actually developing kind of on a, larger scale than just like in utero. And so if there are major stressors or traumas or things that occur during that time frame, it can really make a difference in how, the vitality of those organs as they're, or glands as they're maturing. So I'm always really curious, what happened early in your life that could have been a major stressor, whether that was like a truly like, neglectful experience or like, oh, we moved away and I left all my friends and it was just a really difficult. There's a huge spectrum of like what I mean by big stressors, right? They can be kind of anything. And it doesn't really, the point isn't like how big of a stressor was it, it's just how much that stressed the body at the time. Um, so childhood stuff is going to involve with it. The things that we're just exposed to in our environment, you know, the way that we are taught how to handle our health, I think, depending on the parents you had, I mean, there's like generational stuff. There's literally so many things we could look at as like, how does this happen? And I almost think like, let's just make this kind of a broad, like, here's kind of how this happens, but let's move on to like what we can do. Because
Hmm.
I think we can get really stuck in the past because as humans, we love to make ourselves feel like crap about things we can't control, right?
Right. Right.
And it's like one of the main things we can't control is the past. Like, let's just here's the things that can happen. Okay, great, let's move on. Where's our power in this situation? What can we do now? That's where I like to focus my time with my patients is not like beating to death the past and what went wrong. Because here we are.
Right.
And what do we do now?
Right. That's a really good I love that perspective. And we only get so much time, interacting with people that we really want to make the most of that time and where can we get the best results.
100%.
Although it's really important to know what you can do differently going forward,
Yes. And
right?
that's where I'm like, the power lies exactly in that because when we actually step into like, oh, wait, like I have choices. The two things we can control are our thoughts and our actions, right? That's really it, as much as that sucks. That's really
Right.
it.
Right.
So that's where when we have limited time with somebody to teach them, here's what you can do, here's where you are in control, here's where your power lies. Like that completely shifts the entire thing because we're teaching people, here's the choices you have, and here's how you can, you know, act to, make those choices and figure out what works for you and what's the best thing for your family. And that to me is the exciting part because we're like infusing you could have a horrific, toxic, if you will, past, and it's like, and it's okay. It doesn't mean that you're screwed and that you can't find health again, right? And so I think just hyper focusing on that old stuff doesn't always help people so much, but there's a bunch that we can do, and that's the fun stuff to talk about, I think.
I agree. And it's all always a different story. That's one of the things I love about being a naturopathic doctor, especially a vitalistic naturopathic doctor, is there may be some things that everybody has to do, a few things that everyone should do, right? Eat
Yeah.
good, sleep good, learn to control the way you think, since
Yeah.
that is one of our most powerful superpowers, right? As a human, is we
Yeah.
get to choose what we think and how we think about things, and exercise and sleep and certain nutrients and minerals. Like there are some things that you want to make sure
Yeah.
everybody's doing, but the unknown part when someone comes in is, what's your story? And what, right? Well, how is this
Yeah.
different from the last person that I worked with? Very
Yep.
different from protocol Western medicine, where these are the 5 things you do with anyone with this diagnosis, and that's it.
Yep. Yep.
Um, so yeah, let's talk about that journey to recovery.
Yeah. Which I want to just say for anyone listening is so possible, right? I think I'm baffled at how many people genuinely believe that their situation is helpless and that they can't heal. And I just want to say, anyone here who's listening that might feel like that, that's not true. Challenge that thought. You can 100% live a life that feels joyous and happy. And that's your birthright. Okay. So don't give up hope. I think that's really important to bring up. But yeah, the fun stuff of what do we actually do?
Yeah.
I have like 6 pillars, which I think is kind of, funny because within each of those things, you're obviously like individualizing it and adjusting it because, like you said, what works for one person doesn't work for everyone. And I think of these things as like legs of a stool, and if you have one or two of them, it's like wonky. You can't sit on it, doesn't balance weight, like it's unstable. But if you have all of them, it's a really balanced system. You can, put a lot of weight on it. You can move around on it. Like that's your solid foundation. And so those things are mindset, nervous system, hormone balance, nutrition, um, exercise. Like these are the critical components that we have to have. And within each of those things, there is a million things we could do, right? And like an easy one that I can pick out is with the movement or exercise section, right? People either have like one or two reactions when I talk about this with people because it's either like, oh, that sounds amazing. I'm so happy to hear you're saying, or people like freak out because they're like, no, my entire identity is being this intense CrossFit athlete or like running 20 miles a day or something like super high intensity. And so I either get like it's so interesting how that's like people can really, really fight to the death for the things that are harming them. And exercise, I think, is one of those with thyroid that I get kind of like serious about because I'm like, you can really be like, halting your progress of healing if you were overdoing it at the gym every single day. And it's like, and so then it comes back to like, why are we doing that? Mindset, right? So all of these things I also think are like interconnected in each of their like individual aspects. And I find that like every single one of them where there's like a struggle point, whether that's like I'm struggling to eat the things that are good for me, or I'm struggling to go outside every day, or I'm struggling to whatever it is, usually come down to something to do within the mindset or nervous system category. And so I like so much of what I think is important to spend like the time we have with our patients is on those two pieces because the other pillars, like the other stuff within just like basic, like you kind of the things you were just listing, like sleep, food, water, like, all these things, exercise, those kind of stem from having a nervous system that feels safe and having a body that you respect and love. Because when you have those two things, not only are you activating healing with that safety situation, but you are also able to actually continue doing the lifestyle changes and habits that matter because you don't hate yourself, right?
Mm-hmm.
So many issues I see that women struggle with come down to just like, but I hate myself. I'm not worthy. I don't deserve anything. So like, therefore, why would I feed myself healthy food? Right. So I almost think of like when I have a visit with the patient, I'm like, 20 minutes of it is can be focused on like the easy stuff of like, here's kind of the checklist of what to do for like your basics, the vitalistic stuff, right? The like fun, awesome, like amazing, powerful stuff. But it's like, but why aren't we doing that
Mm-hmm.
once we know? And so I think I spend a ton of time on nervous system and mindset stuff.
Mm-hmm. Mm-hmm. Well, of course, that makes so much sense. We are who we think we are. Our life is what we think it is. Our worth is what we tell ourselves our worth is. And you have to learn to have a different conversation with yourself. That's
Yeah.
changing your mindset, right?
Yeah, I mean, it's essentially looking at like, some of the work that I like to do with people is some exercises to go through finding like what are your limiting belief systems that are really like your foundational circuitry in your mind. And one of them that I hear a lot is like, well, everyone in my family's sick.
Right.
This is just kind of my lot in life. There's so much where we are just like immediately giving away our power to other people, to other situations, to external things. And genetics become a really fun scapegoat too of like, oh well, every woman in my family has Hashimoto's, so like therefore I do too, and I can't, and it can't go in remission. And it's like, well, if you truly, truly believe that, that's going to be our biggest barrier. You better bet I'm going to spend all my time working on that with you, because until we shift the belief that like, oh no, I can insert whatever thing,
Mm-hmm.
have more energy, be happier, not have so much joint pain, sleep at night, et cetera, et cetera. Until you believe that's possible or that you uh, uh, are deserving of that experience, like it's going to be harder to come by, and you're going to blame like, oh, well, no diet works, right? Um, you're going to blame all these other tools of like why they're not working. And also, I mean, genuinely, this, I think a lot of us vitalists know this, but within our nervous system, if we perceive on any level that there's threat, which like, hello, every single person out there is like crazy stressed and feeling threatened all the time, our body is more going to halt that healing process and be like, I don't think that I'm completely safe yet to like go full to work on healing this thing, right? So much of our job as vitalists is not just the like, here, eat this thing. It's like, let's get you safe so that you can actually, like with longevity and sustainability, get these things done and see, because consistency over time is where the magic happens, right? You would agree with
Right.
that?
Right. I
Right.
do. I
Doesn't
do.
If you do something for 6 weeks or 6 months, that's wonderful. But if you stop after that, and like, that's not what we're going for. We're not looking for a kind of a quick fix, temporary thing. So that you can, because people are always asking like, okay, well, what can I do to like go back to what I was doing? And it's like, okay, that's again where we're looking at like mindset, right?
Right.
So there's so much of that I think wraps into everything that comes with health and making healthy lifestyle changes that I think is like under talked about, I think, in the like health
I think
space.
so. I think so. Absolutely. And you touched on something really important there where you said, when I can go back to what I was doing before, right?
Hmm.
Well, doing what you did before is part of what got you to where you are. Why would you want to go back to that, right?
Yeah.
And
What's happening in that process? Yeah.
yes, yes, exactly. I remember years ago, and I don't know if we were at a conference or we were having a conversation, but I was talking with Dr. Jim Sensenig, and he was talking about this, the way we think of what's possible for ourselves based on what we've been told or what we've chosen to listen to in our life. And he had a guy with ulcerative colitis come in to his office. And this guy had seen lots and lots and lots of doctors, and he'd worked with people for almost 10 years. And he came in, and Dr. Sensenig said it was almost like he came in just so he could hear the same thing again, that there was no hope for him, that he was going to have to be on steroids and all these medications. And the guy was sitting on his table. And for any of you who saw Dr. Sensenig as a patient or worked with him as a student, I was lucky enough to spend time in his office with him. And the main feature in his exam room was a table where you could lay down and he could adjust you and examine you. I mean, it was right in the middle of the tape of the room, right? And he got the guy up on the table and he said, before we start, I really need to tell you that your body can heal this. And he said it was like the person's demeanor changed, because it was almost like that's the first time somebody introduced the possibility that his body could heal itself. The guy
Totally.
went on to complete remission over time, right?
Over time, yes.
Over time. And his life completely changed in how he thought, what he did, how he took care of himself, because that has to happen, right? We
Yeah.
know this. So you do definitely work on mindset, nervous
Well,
system
and I always,
on that.
on that same thought, I always tell people, you can't heal a body that you hate. We got to start there, right? Because I think, I mean, that example you told is so awesome because as vitalists, we know that to be true. That's like an everyday occurrence. We're like, of course, your body can heal this. That isn't a new thought for us, right? But we're so inundated within that day-to-day structure that it's this like not even a second thought. Most people don't ever hear that. They have no idea. They've been,
No.
just absorbing messages from the outside world forever. And also, right, we come to this place of like, well, because X, Y, and Z thing in my life suck, I suck, I'm bad, something is wrong with me, I'm inherently broken.
Mm-hmm.
And that is some of the deep stuff that like has to be rewired. Because again, I think I probably sound like a broken record, but when you don't respect yourself or your body, it's really hard to over time, like we're saying,
Mm-hmm.
consistently stick with changes, even if they're pretty easy, simple things. I think people expect that lifestyle changes and diet and things like that are going to be just like horrendously difficult, and they're really not. But I think what gets in the way is like are you familiar with the idea of upper limiting?
No.
Have you heard that concept? Oh my God, Eli, you should.
No,
So
tell me.
Gay Hendricks, he's like probably him and his wife are the main like kind of teachers of this concept. It can be life-changing. The book that I would recommend starting with is called The Big Leap. But it talks about this concept called upper limiting, where basically we have like a thermostat or like a ceiling on what we can tolerate in terms of like positive feelings and like
Mhm.
joy. And so if we're like used to feeling really crappy and just like it's kind of suffering, like we're a little addicted to just feeling bad. We will like, as we're making changes and as we're like feeling better, almost freak ourselves out and be like, whoa, like this is too good. I don't deserve to feel that good. I'm going to do something to self-sabotage. So, right, something we see all the time with people self-sabotaging when it's like, sweetheart, I know you know the thing to do, right? This is not an education issue at this point, but the same kind of sabotage keeps coming up at these like consistent junctures. And it's like we upper limit constantly, and that's how it shows up as like self-sabotage, procrastination, like making ourselves feel bad about X, Y, or Z thing, thinking thoughts that we, are kind of old stuff. It's his book is so good at just like introducing this topic in a way that makes a lot of sense to like any person on the planet. It isn't like written for doctors, right? It's just like it's so good. And I think anyone out there that like might struggle with self-sabotage or like, oh, I know what to do, but I can't get myself to keep doing it. Like this
Yeah.
book is a really great place to start. Again, it's called The Big Leap by Gay Hendricks. Eli, you'd probably really like it too.
I'm gonna go get it. I'm gonna request it into the
Yeah.
library for sure.
Yeah. They have it on like Kindle on Libby. So if you have that app, you can get it there too. But it's a really good. And he like introduces, here's kind of like the four, I think it's four. There's like a handful of things where he's like, here's kind of the most common like deep-seated beliefs that people will like have that they'll upper limit when something starts to kind of like, test that.
Mhm.
And so it's so good. And I think everyone should read this book.
I'm
But we're
excited
looking,
to read it because
yeah,
I
but
see
looking at,
that. I see that
yeah,
with patients a lot. So
and it's
they,
heartbreaking.
right, they make some change, things start to shift,
They feel
and
good.
then something happens for some reason, like they believe they're not worthy
Yep.
of this goodness that's starting to manifest itself, that
Yep.
they've actually put into motion to manifest, right? I'm
Yep.
excited to read the book. Thank you for
Yeah.
sharing that.
Yeah, it's like it's like an easy book. It isn't like, because some of the books on like, I think mindset and trauma, like are like dense textbooks. And I'm like, I don't even want to read this. Like, like I cannot expect my patient to read this. So I like books where it's like just simple. You could read it in literally an afternoon. Like it's just a super quick, like a quick win.
I like books like that too.
Yeah.
So Another question I think that people have is can I heal from this? Can I heal from Graves? Can I heal from
Yes.
Hashimoto's? Do I have to be stuck on, you know, pharmaceuticals for the rest of my life that aren't really even doing a good job, right, at helping
Yeah.
me feel good?
Yes, you can heal. Yes, you can heal. Okay, just hear that. No, you don't have to be stuck on things that you don't want to do. I think no, like especially within Graves, because there's more risk with, unmanaged Graves disease. Um, People get fear mongered. Like the diagnosis is almost akin to like getting a cancer diagnosis where you're like, okay, we found this, and you're like immediately, bombarded with overwhelming, scary information. You're like shuttled to the next thing, or they're like, okay, now we're gonna take your thyroid out, or we're gonna kill it, and you'll be on this for the rest of, and like people don't have a second to even process what the hell has just happened to them. So I
Yeah,
think in the context of thyroid, Graves for sure ends up being, I think, the most intense from like diagnosis to treatment, because it's like you're told also if you don't do these things, then you're going to certainly die.
right.
And what I'm not advocating for is to just like have unmanaged Graves' disease, right?
Right.
There's this, I think, people get like in the natural versus conventional world, they can be like almost forget that like when you're treating it with other modalities, you are still treating it.
Right.
We're not
Right.
just doing nothing and being like, well, it'll go away on its own, sweet flower child, good luck, right?
Right.
So I think, yes, you can heal. And Graves, I will actually say, is one of the things that I see heal the quickest and the most reliably of all the autoimmune stuff. And so I jokingly am like, I love treating Graves' disease. Like I love seeing that come in my door because I don't like know it's going to get better if the person is willing to put the time in and, and shift the way that they're thinking and kind of like actually do the things we're talking about. Because again, you can know all the best things to do, and if you don't do them, it doesn't matter.
Mhm.
Um, but yeah, you can heal. No, you don't have to be dependent on medications or surgery for the rest of your life. Um, there's so much you can do, and not even complicated, hard, like gross, scary stuff. Like it's very realistic, normal people things that are not too hard to do. I think anybody can do them. I'm like the not the laziest person in the world, obviously, because I became a doctor, but like I'm not one to be like 20 hours meal prep. Like I don't enjoy, I want to be out riding horses and like playing outside. So it's like I don't if it's doable for somebody like me, I promise anybody on the planet could do it. So there's like that, I think, myth of like, oh, if I change my lifestyle, it's gonna make I won't be able to I'll have to like sell my soul to meal prep or something like that.
Right.
And it's like
Right.
no, but we have to figure out why you like aren't willing, where that mindset block is of like why that's not happening. So yeah, it's possible. You can of course heal. Even if it's autoimmune, people get really hung up on like, oh, but it's Hashimoto's or but it's Graves. And it's like, and like it can it's that does it's the body can heal and doesn't have to do things that don't resonate with you. And I think that's also really important because I wouldn't force somebody that like didn't resonate with what I offer to do it. Because I think that what is going to work for us is what makes us feel safe.
Hmm.
Because that goes again back to nervous system. If we feel something is like threatening or scary, we're going to resist it and it's going to be harder for that thing to work. So I think it's important that you're like resonate with the style of treatment that you're going for.
Hmm. Hmm. So once you get the first two pillars sort of worked through, and I'm assuming you have herbs, you might have supplements, you might have homeopathy, like the
Yep.
whole range of tools that
Yeah.
a vitalist uses. You use these in your practice as well.
Yeah, 100%. And they work really well.
Do you do
Yeah.
hydrotherapy?
Yeah, we have a full-time hydrotherapy. Our medical assistant does hydro full-time for us. So we have a hydro suite that's running all day, 5 days, 4 or 5 days a week.
Isn't that a
Yeah.
powerful modality?
It's pretty amazing. Yeah. We had a patient who and it's a funny situation because he's a really like funny guy, but I don't honestly know why he came or why he stuck with it, but he basically didn't do anything we said except the hydro, which like right, that's just funny because you're like, why are you even here? But he did the hydro. And we do the like the bowl and blood pictures, so we'll look
Yep.
at blood before and after. And his before picture was pretty, needed a lot of work, we'll say. He was pretty sick, and he was the most non-compliant, like didn't want to do anything. He did like 15, I think exactly 15 hydros, and we did his blood picture after, and it was beautiful. And he was like had energy again. His big thing was like he wanted to be able to, he was an athlete and he was struggling with like muscle weakness. And he was like by doing 100-mile bike races, like all this stuff. And it was like largely just with hydro. And you don't get the chance to really tease apart how much does one thing do because we're kind of looking at the symphony of all these things typically.
Mm-hmm.
But that was a funny situation where like, okay, well, the hydro, even just a handful of them is like obviously working miracles because look at him now, you can't hardly stop him.
Mm-hmm. Mm-hmm. And
So
once you
yeah,
start to heal and start to feel better and start to shift, that's, I think, really when people dig their teeth into it and they're like, okay, if this helped, what else can I do for
yeah.
myself?
Yeah, it's a snowball effect, right? I think,
Yeah.
and within like within the pillars that I work with people that are largely right, this like it's a kind of a fancy term for just like the basics of health. Um, say they're like not quite, they're like open but not quite ready to like, maybe do some of the deeper like limiting belief work, or they're not ready to like sit with an emotion yet. We're kind of like, I'm like, you can get in the house through any door. They
Mm-hmm.
all work, right? And so
Mm-hmm.
like whatever of like all these things we're looking at, what feels like the easiest place, like the least resistance, just like absolute ease to start with. And let's begin with that because sometimes that's as simple as just drinking enough water in the day. I'm like an obnoxious like water. I like talk about water so much. It's honestly probably weird, but like say it's just like drinking enough water, purified, healthy, like mineralized water. That's going to be making you feel better. That's going to be making you feel like a success. And that's like, and you're going to build on that stuff. So I'm always like, there is no like there's no perfect nugget of like where we start with. We kind of know we have to get to all of them for this to last and really be what you're like looking for in terms of like kind of feeling like a superhero. But like start with the path of least resistance. And maybe that's through the nutrition door. Maybe that's through the movement door. Maybe that's through mindset. It doesn't really matter. Just get in a house and
Mm-hmm.
it's going to start to like build from there.
I think of complicated homeopathy cases the same way. Sometimes people come in to see me and I take their case and the remedy's very obvious. And they get the remedy and all the basics, take care of that. And they start reacting. But sometimes folks come in and they have years of suppressive treatments on board and all kinds of noise in the case.
Yeah.
And I'll tell my students, we just have to start somewhere. Let's find a door to get through, and then it will all work out, right?
Yep. Yep. Just get in the house. Just get inside.
Right. What windows open enough for us
Yeah.
to
It's like
get
there's a
through?
tsunami outside. Let's just get in shelter.
Let's get in
Right?
shelter.
Because really, I think what people don't also correlate with like when I talk about, because I talk about nervous system stuff like a lot with people. And I think I really harp on this idea of safety, right? But what people don't always like connect the dots of like you can create safety in the cells by like not skipping meals, right? You create safety in the body through a million different ways that aren't just dealing with limiting beliefs and like that kind of stuff. It can also be as simple as like getting out in the sunshine on a regular basis. And so your body starts to like trust things are going to happen. Like you can create safety through these other doors. And I think people don't always get that. And so that education about like looking at it from that lens of like, if diet feels the easiest for you, or if, this other thing feels the easiest for you, here's how that's actually creating safety for all these other things to take form and to work better and all together and kind of create that synergy that we're always looking for. So yeah, it's just like start somewhere and I guarantee it will be that like first domino and the effect of like your body starting to be like, okay, maybe I can like peek my head over the fence and be like, maybe I'm okay. And it starts to build from there.
Mm-hmm, mm-hmm. Well, and often I think one of the first hurdles that we have to overcome is the messaging of you need surgery or you need this pharmaceutical, and that's the only
Yeah.
way you can go forward. So sometimes we
Yep.
have to uncondition or decondition before you can recondition. Yeah.
Yeah. And some people feel more comfortable because I mean, I think this is more common, I think, with people I see with Graves. I would say I have like a pretty fair split of people who are like, I don't want to ever touch medication or anything conventional. Let's do it from scratch, right? And then some
Right.
people who are like, I feel the most comfortable like starting with one of the easier medications and then like seeing what can happen. That sort of feels like the door that makes it is
Mm-hmm.
safest for them.
Mm-hmm.
And like whatever is fine because realistically, like even if you start a medication or if you're on a medication right now, like if one of your goals is to stop that medication, that's also possible, even if you've been on it for a long period of time, years, right? That's not so. I also want to just like for anyone listening, there's no like right or wrong or like morally better way to attack it, depending on how you've done it in the past or how you were doing it now. Like,
Mm-hmm.
now is always a fresh moment, and it's like, what's your goal? Kind of what's your driving motivation? What is it that you actually want? And, if that's the case, like, yeah, I've had plenty of people who we get in remission from Graves without ever touching a pharmaceutical, and I have plenty of people who are already on the medication when they come to see me and we get off of the medication, right? I have plenty of people who are coming wanting to just avoid the surgery and we do that. So it's okay. I just want to tell, it's like okay if you've opted for medication because you felt like you had no other choice and you were scared, that's okay. And if you want to not be on that forever, that's also possible.
Mm-hmm.
And you always have options. I think just remember you always have options and your body is amazingly capable when we treat it right over time.
Mm-hmm. Mm-hmm. Well, that's, I think, one of the most special things about vitalistic naturopathic doctor is, and other naturopaths as well, right? I mean, it's a paradigm, but being able to meet the patient where they're at and not have a preconceived idea of how things should go. Like,
100%. Yeah, that's exactly a beautiful way to put it. Because when we're ever using the word should, I think in the context of this stuff, all I hear is shame,
yes,
right? And I
yes,
think that there's like no, we don't need more of that. There's no room for that in the healing process. Like, what can we do, not what should we do? What do we want to do, not what should we do?
yes, yes, I completely agree with you. So I heard through the grapevine that you are releasing a self-study course.
Yes, this is like my passion project, baby child. Because I've been asked, like, because obviously it's like one person doing this work. You can only, say I was seeing people 24 hours a day. I'm still very limited as how many people can even access this kind of information. And as you were aware, as someone who like writes books and is educating, it's like when you have this drive, you're like, I want as many people as possible to get better because I think, and the reason for me that's like my why with this is that I truly believe that the health of our planet and our world gravely depends on the health of each individual person and us stepping back into our power. And that starts with our health, right? And I think part of the like long-term crap we've had in the healthcare system is like a way that keeps everybody stuck and small and ill so that we can't be magical.
Yeah.
And so what I want is for people to have access to that information to, basically be powerful superhuman people that heal the world. So I made a course so that people don't have to come to Colorado to find that information if they want it. It's 100% self-paced. It's just like an online course that they can go through. And I like that actually because sometimes like with people that with one-on-one work, you can feel like somebody might need, more time in one section than the other. And so I think that there's something really beautiful about having it be self-paced in that way of like, nothing is, you don't have to rush things if you're like, I really need to kind of just spend time in this one module or this one pillar. But yeah, the whole point of it is so that people can, take this course, learn the skills that they need from like all of these things that we've been talking about, the, nitty-gritty of here's all your options of like within the nutrition category, here's all the things that are like the most important for your body to be able to heal so that they can start and it's not like, they're dependent on another provider, a medication, another surgery.
Mm-hmm. Mm-hmm.
They have the tools at their disposal, like they're empowered with that education to be able to heal their body. And they don't have to fly across the world to come see a practitioner that they, might want to. And as many people as possible can hopefully access it and share it with people that they might benefit from it and need it.
Well, I'm so excited to learn about this because you're right. The more people we can reach, the better.
Yeah.
We're fighting. I think of it as kind of a fight where we're fighting an industry and organizations and companies who have millions upon millions of dollars to spend on marketing and advertising. And here we come along, right? We're a small group of practitioners relative to the huge body of healthcare practitioners out there with kind of a different message.
Yeah.
And it can be tough to get that message out. And courses like this and, talks that many of us do, books that we write, this can reach people because you can't work with everybody,
No, and that sucks. Like you hate that as a doctor. It's
right?
like that's the thing that kind
Yes.
of keeps you up is like crap. Like I can't. I'm so limited as one person.
Yes.
If I just limit myself to like only one-on-one.
Yes. Yes. And courses and workshops and things like that let you reach a much broader scope. And once people take the course, do they have an option to work with you telehealth if they need more one-on-one care?
Yeah, of course. Of course, my hope is that people, wouldn't need that because my hope is that I've given them enough resource. But yeah, there's always going to be situations in which people need a little bit extra support or
Yeah.
help. What I plan to do also is have like within the cohort of the course students to do like group trainings where there's
Mhm.
like built within the course, maybe like once a month or something like that. We're actually kind of doing sort of like group coaching or group educating.
Mhm.
But yeah, I will still always have my one-on-one options available. And I think, people will probably get even more out of that having gone through the course first because they're going to have a really strong foundation and will be able to just like fine tune the kind of nitpicky last little bit of things for some of those people that just need a little bit more support.
Yeah. Well, I find that in any of the courses I've offered, 90% of the people can get through the course and find transformation and manage their health and their wellness in a different way. But there's always that small group of folks who need
Yeah,
much more one-on-one work. They're just unsure,
yeah,
or it's
yeah.
there's complications, right?
Totally, totally.
Yeah.
And yeah, so that part will always be open. I do still think that because I've worked with a lot of cases too where I'm like, they got better in like 4 weeks. And I'm like, okay, you could have taken this course in probably like less time. And
Yep.
and that's like so exciting and amazing to think about. Um,
Yes.
so yeah, it can be quick. I think healing can be really quick, which is amazing. So I'm hoping everything that I know and love and care about has been poured into this project. And it covers like how do we work through eliminate? Like it covers even the mindset stuff like we're talking about. I mean, I think it's really one of the like not only does it go through the basics that we know of lifestyle, like nutrition and hormones and yada yada yada, but it's like, and here's how we also heal like the mind body piece of it.
Oh, good. That sounds
Yeah.
awesome. Well, we'll definitely make sure and put the links for all of that up. And is there anything you want to leave our listeners with before we wrap up? That hour went so fast.
I
My,
know, it's such a fun conversation.
yeah,
I would guess the last thing I would just say is that everyone listening, you are lovable and you are loved.
what a great thing to end on. Well, thank you for being here. And
Yeah.
y'all, the all the links and all the information about Dr. Cook will be easily found on the podcast pages. So thank you.
Awesome.
And everyone have a
Thank
great
you
week.
so
I'll see
much.
you next week.
Bye, Eli.
Bye. Thanks for joining me today. For those of you who have written and emailed and are interested in my books and other offerings, I wrote The Unvaccinated Child as a resource guide for parents and caregivers to navigate childhood illnesses in a natural and healthy way. And while the intended group was the unvaccinated, it turns out it's an important resource for the vaccinated kids as well, since vaccines do not necessarily prevent illness. Smoke Rings is another book I wrote, and that's to help smokers support their health, regardless if they plan to quit or not. So, for people who smoke, love a smoker, used to smoke, continue to smoke, this book helps you be your healthiest version. And when I say it is judgment free, it is absolutely judgment free. You're free to make the choices you make. I'd just like you to find better health while you make those choices. My most recent book, Homeopathy, A Foundational Approach, is really great for someone, whether they're a complete beginner or they've already been practicing homeopathy. It starts at the beginning and it guides the readers through the basics and on into first aid and acute practice, so you can start using homeopathy right away. That's the most important thing to me, is to get folks using homeopathy in their everyday life. My workshops and courses can be found at either ecampnd.com or longshadowsranch.net. Have a great week. Again, thanks for joining me and thanks for your support.